Hello, and welcome to today's presentation on ethical communication and research for respiratory therapists and other allied health professionals. As we explore this topic, we'll cover essential scientific communication principles, ethical implications in human research, and best practices for communication within our profession. Whether you're a new therapist or a seasoned professional, ethical communication is fundamental to our work and impacts patient outcomes, professional integrity, and the advancement of our field. Let's begin by discussing the principles of scientific communication. In the healthcare profession, our responsibility in research extends beyond data collection and analysis. Effective scientific communication is guided by several key principles. Number one, accuracy. Information shared must be precise, factual, and free from exaggeration or distortion. Number two, transparency. All findings, even those that may not support the hypothesis, should be disclosed. This helps build trust and contributes to the integrity of our field. Number three, clarity. Avoiding technical jargon and focusing on plain, understandable language is crucial to ensure accessibility for a broader audience. Number four, responsibility. Recognizing the potential impact of communication on patients, family, and our colleagues, we must be cautious and deliberate in how information is conveyed. And finally, respect for privacy. Patient information must be safeguarded and autonomy maintained in all communications unless specific consent is granted. Each of these principles helps ensure that our work not only supports scientific advancements, but also aligns with the highest ethical standards. Now let's delve into the ethical implications in human research, especially as they pertain to allied health professionals. When conducting studies involving human subjects, respiratory therapists face unique ethical responsibilities. Informed consent. Ensuring participants fully understand the research, including the potential risks and benefits, is essential. In respiratory therapy, where research might involve respiratory interventions, obtaining informed consent helps protect patient autonomy and well-being. Beneficence and non-malfeasance. We're committed to do no harm and maximize possible benefits. This means that any procedure, intervention, or observational study we undertake should be designed to improve patient care, not just for scientific knowledge. Confidentiality. Patient health information is protected under HIPAA and must be strictly safeguarded. In research, we often need to autonomize data or obtain specific permission to share any patient-related findings. Equity and justice. All research participants should be treated fairly with equal access to participation without discrimination. In respiratory therapy, this might mean ensuring studies are inclusive to different demographic groups, especially those with conditions disproportionately affecting certain populations. Navigating these ethical implications is crucial for conducting responsible and impactful research. Now we'll discuss ethical issues and communication in respiratory therapy. In respiratory therapy research, ethical communication presents additional challenges and considerations. Let's examine some of these issues. Number one, potential for misinterpretation. Research findings need to be communicated carefully, especially when discussing clinical implications. Misinterpretation can lead to inappropriate expectations among patients or healthcare providers about therapies or interventions. Patient autonomy. In some cases, communicating research procedures or findings might impact the patient's willingness to participate or continue with treatment. Clear and honest communication about study goals and patient roles helps support informed decisions. And finally, data interpretation and reporting bias. In respiratory therapy, even minor biases in interpreting results can influence clinical practice. Accurate reporting, free of any personal or institutional bias, is essential to maintain ethical standards. By recognizing these issues, we communicate our research in ways that respect both scientific integrity and patient rights. Communicating effectively with patients, families, and healthcare providers. Effective communication within our scope of practice is another crucial skill in respiratory therapy. Here are some strategies to foster clear and respectful communication with patients, families, and healthcare providers. For patients and families, use plain language free of complex medical terms when discussing diagnoses, procedures, or research study. Always allow time for questions and be attentive to nonverbal cues that may indicate confusion or concern. For healthcare providers, sharing research findings or clinical observations with colleagues requires precision and context. Presenting information in a way that highlights its relevance to patient outcomes can foster collaboration and deeper understanding. Using empathy, particularly when discussing sensitive topics. Empathy plays a vital role. Patients and families often feel vulnerable, and showing understanding and support can make a significant difference in how they receive information. This commitment to effective communication fosters trust and collaboration, which are essential for patient-centered care. Next, we'll discuss effective skills for writing correspondence. In addition to verbal communication, written correspondence is a critical component to our professional communication toolkit. Here are some best practices for crafting effective written communications, whether it's research findings, clinical updates, or formal correspondence. Number one, clarity and conciseness. Ensure that your writing is straightforward and to the point. Avoid unnecessary jargon and focus on delivering a clear message. Number two, formal tone and structure. Use of professional tone and follow a structured format. With an introduction that provides context, follow the main points in a logical order and close with a summary of action steps. Number three, accuracy and precision. Double check all details, particularly when presenting information, research results, or patient information. Small errors can lead to significant misunderstandings, so it's essential to verify facts before sending. And finally, number four, audience consideration. Tailor your language and consent to your audience. Correspondence to a peer might be more technical, while communication with the patient should be more accessible. These strategies help maintain professionalism and ensure that our written communication is as impactful and respectful as our verbal communication. In conclusion, ethical communication in respiratory therapy research is multifaceted and vital to our profession. By adhering to these principles of scientific communication, understanding ethical implications in human research, addressing specific ethical communication issues, and honing our skills to both verbal and nonverbal communication can contribute to a transparent, respectful, and effective healthcare environment. Thank you for joining our presentation. As we continue to work, let's remain committed to these ethical standards and prioritize the dignity, trust, and well-being of those we serve. Thank you.